Hi everyone! As you know, I've been very open about sharing my pregnancy journey with Kaden and Caleb for the past 2 years. To help other mummies on their pregnancy journey, I'm here with Dr. Tan Kailit, a gynae today. He's going to tell us more about what it means to have a healthy pregnancy diet and to eat for two.
Hi everyone. So, Batila, some mums experience bigger appetites when they are pregnant. Do you remember your diet changing during your pregnancy?
Actually, for my pregnancy, for both, I didn't really eat a lot, but I do remember that I had some cravings, like I had spicy food and sometimes sweet stuff as well.
Having cravings is totally normal among pregnant women. But did you notice anything about the amount of food that you ate?
I didn't really eat a lot during my pregnancy, but I do know that certain mummies, they eat more when they're pregnant. And what do you think what it means to eat for two? Do they have to eat a lot more or?
During the first trimester, you don't need more nutrients than you usually do. The recommendation is actually to eat for one. During the second trimester, you should eat a little bit more calories and slightly more in the third trimester. Be careful not to binge eat as well. Okay, so remember to have just a balanced diet and not too heavy on carbs and fats. Excessive carbs predispose one to be overweight, which predisposes you to complications such as diabetes. So both mom and baby need nutrients. It's normal for moms to feel more hungry than usual. You're right to want to get nutrients for your baby. Just remember that you need to get the right nutrients and in a healthy and balanced way.
So that's really helpful. So are you trying to say that it's not necessary to eat for two when we're expecting, but to focus a bit more on maybe the nutrients and not really the quantity?
So it's a common misconception that eating for two equals to eating twice the amount. It's not about eating more the food, to actually feed two people. Okay, the baby's nutrition actually depends on mom's diet. Okay, so what moms need to do is to increase the quality of what they eat instead of the quantity. So mothers should focus on increasing the nutrients in their food to support the baby's growth and development.
I think it's good to know that we don't really need to eat for two because I have read up that 1 in 4 pregnant moms actually put on unnecessary weight during pregnancy. How can we ensure that we are getting the right nutrients without having to eat more?
Great question. So for balanced and nutrient-dense meals, this includes having higher complex carbs like oats and brown rice. Milk is also a good source of calcium. Soybeans are also a good alternative source of protein. Of course, we can't forget our fiber-rich fruits and vegetables such as papayas, oranges, carrots, broccoli. These contain important vitamins and minerals as well. And another tip is to get vitamin D from the sun.
Okay, thanks for the great tip, Dr. Tan. I think it's really important for mummies to actually know that it's not really about the amount of food that they eat, but the type and the quality of the food that they eat. Maybe you can also share what are some nutrients that they should actually look out for. I know that calcium and folate is quite important during this pregnancy journey.
Yes, these nutrients are important, okay? But the key thing is to eat a balanced diet, which will help you get all your nutrients. You get calcium from milk, fish and bean products too. Some other important nutrients, example, iron, folate, vitamin E, DHA, and other vitamins and minerals.
As a working mom, I think it's quite hard to really find the time to, go out and eat and taking all these nutrients. So I've heard that maternal milk can actually help in providing these nutrients, which maybe I don't have the time to cook or to really get this food. What are your thoughts about that?
So drinking maternal milk that contains essential vitamins and minerals can help moms address the gaps in their nutrition to meet their increased nutrient needs during pregnancy. It can be a convenient, low-fat solution for busy moms, serving as a nutrient-rich snack or meal supplement. But of course, if possible, you need to prep the meal yourself and plan your diet. So as we spoke earlier about eating for two, quality is what matters to avoid unnecessary weight gain while ensuring mom and baby get the nutrients they need. So moms watching their weight during pregnancy can opt for maternal milk that are low in fat so they can get valuable nutrients without extra calories. And it's more than just the milk. So there are other supplements that are available. So it really is up to the mom to see what fits them best.
Thank you, Dr. Tan, for explaining all of this. I think I've learned that it's not really about the quantity of the food, but more about the quality of the food, and sometimes we can get the nutrients through supplements and maternal milk as well.
That is correct, Batila.
Thank you. Do you have any last words of advice for mommies out there?
But just remember that everything in life is all about balance. So remember to have a balanced diet. You need it to get nutrients from supplements, and importantly, to get your exercise and also get your sun.
Okay, it was really nice to speak to you today, Dr. Tan, and thank you so much. Bye.
Welcome. Bye.
Consumer education brought to you by Similac.